You're listening to Crashes, Claims, and Clarity, hosted by Darrell Burrow, a Georgia-based personal injury attorney with over 30 years of experience and founder of Burrow and Associates. With a background in both legal strategy and compassionate client care, Darrell has helped over 10,000 individuals and families navigate life after injury. Guided by his Christian faith and a deep sense of justice, he brings expert insight, personal stories, and powerful interviews to every episode. If you're looking for truth, support, and clarity in the aftermath of an accident, this is your place. This is Crashes, Claims, and Clarity.
Well, hello everyone, and welcome to another episode of Crashes, Claims, and Clarity. I am your host, Darrell Burrow. I'm an attorney right here in the state of Georgia, headquartered in Gwinnett County, although we serve all of the state of Georgia. And today is a very important topic. We're going to be talking about how sometimes after a wreck, the symptoms of injury may not make themselves immediately apparent. In other words, people walk away saying, well, I think or I believe that I'm fine. And we do hear this all the time. Oh, it was a minor wreck. But the truth is that the body oftentimes does not line up with what the accident report says the damage to the vehicles turned out to be. Pain can show up a day, days, if not longer period of time after that wreck occurred. Movement can change, different chemicals that are coursing through the body and affecting the muscles and other soft tissues. And that's the period that a person says, well, something's not right. This is not normal. My guest today is Jay Lerner. He's a chiropractor with Southern Crescent Clinic. He helps people recover from automobile accidents, chronic pain, and physical injuries. He helps people understand what happens to the body after a wreck occurs, why some injuries might be delayed in their appearance, and why recovery is not the same for every single person that is involved in one of these wrecks. Well, Dr. Lerner, thank you for joining me today.
Thank you for having me, Darrell. I appreciate it.
Yeah. And it's good seeing you again. We've met before. Glad to have you on.
Thank you. Glad to be here. Yeah, it's good to see you again as well.
Well, let's jump right in. People often say, oh, well, this was a minor wreck. What is it that people misunderstand about a so-called minor wreck?
So that's a great question. And we get that a lot, fairly often. So really, there is no minor wreck. The property damage to a vehicle does not directly correlate to the damage to an individual, to your physical being. You have to understand there's approximately 2,000 pound vehicle, sometimes more, that are colliding at a certain velocity, and that some are built differently. Obviously, they can withstand that physical damage to that property, but all of that inertia, all that energy is being translated. If you're not seeing it on the body of a vehicle, it's translated into the interior and the soft tissues of the individual or individuals that are inhabiting that car or that truck, that vehicle. So in other words, if you're going X miles per hour and you get slammed into by a Ford F-250 or a small vehicle, all of that energy, all of that inertia is being translated into that inhabitant, the occupants of the vehicle. Now, some of those occupants may be more susceptible to injury than others. They may not be in the greatest physical condition. Sometimes, what we refer to as an eggshell, where someone has, even if they've been involved in injuries in the past, or they have certain amount of degenerative changes going on within their body, known or unknown ailments going on, that force is being absorbed by their body, and that translates to physical injury, which is why they need to be checked out, be evaluated, examined as soon as possible after those injuries, whether they feel, physical pain or not. And pain is very subjective as well. So someone adrenaline is going, you have that type of injury and your adrenaline is pumping, coursing through your veins. That can delay the onset of those physical symptoms.
So that would be a reason that someone would say, well, I feel fine, but then later on they're feeling something different, symptoms.
Absolutely.
Yeah.
And also to that point, sometimes, if someone maybe even feels some minor discomfort following any type of injury, whether it be an automobile crash, a slip and fall, a sports injury, a lot of folks will use heat. Heat feels nice. Heat feels good. What that's doing, you have they have an inflammatory cascade coursing through their body, and inflammation is deadly. Inflammation is at the source of a lot of physical issues. And adding in the word inflammation, you have the root, there's flame, right? You put heat on top of that, and it may feel nice. It's bringing blood flow to those injured tissues, but it's congesting the area and potentially making it worse.
Mm.
It feels nice. A lot of people would opt for that over, something cold, ice, but that is the way to go to decrease the inflammation. Inflammation serves a purpose. It's bringing those chemicals, those healing, blood flow and healing chemicals to that area, but it's not flushing out. So it's inflaming and congesting that area. A lot of times that's what we find is that someone will come in 2, 3, 4 a week, after an injury, and they've been using heat. It felt good. Again, it's bringing some good healing chemicals to the area, but they're not getting rid of it. They're not,
Okay.
It's staying there and it's not flushing back out. Which is
Yeah.
why it's very important. Also, I always recommend drinking a lot of water following an injury, and maybe even including electrolytes. That helps tremendously.
You've mentioned that as a hindrance to recovery. What about stress or anxiety or the fear responses in the body that people go out, especially after a wreck that
Sure.
people experience?
Oh yeah, it's a traumatic incident. And on top of all that, you have all of the headache of the property damage to the vehicle, dealing with that. You've got, you have to continue to take care of your family and go to your place of employment. That in and of itself, depending on what the occupation is, may add to the trauma. If you don't want to stay stagnant, but you also don't want to do things that are going to make things worse. So one of the worst things to do is to do too much activity.
Okay.
Another one of the worst things you can do is do not enough activity, because you may feel like you're going to have pain or you are in pain. People tend to sit around. They tend to sink into their couch. And that's one of the worst things you can do it may be uncomfortable to move and to be physically active, and I hate to use this phrase, but sometimes, the no pain, no gain comes into effect. Not necessarily pain. You don't want to damage, so there's a fine line. And that's what I try to counsel and educate people on, is that balance. Your body needs to rest, but you also need to remain active, physically active. And also back to the point of the stress and anxiety, mentally active.
Okay.
Because there are, hidden brain injuries as well. And you don't want to, again, stagnation is detrimental, highly detrimental. So, you want to remain active. You want to keep your brain, whatever it is. If you can't work. If an injured patient can't work due to their injuries, the worst thing to do is to remain totally inactive,
Right.
whether it's
Right.
physically or mentally, and we tend to help with a lot of that as well, or at least, get them to the right place where they can talk about their anxiety, their fear, and hopefully within a short period of time overcome that and
Hmm.
be able to get back to their routine and their normal activities of daily living. And
Okay.
hopefully after, proper treatment, they'll be maybe even a little better than they were prior.
Right. Right. How do you counsel people that you've recommended them for some further diagnostic? Maybe it's an MRI or something else, and there's really not there's not an answer to their question of what they're experiencing, but they're still having these symptoms. How do you counsel those folks?
When, if say some diagnostic imaging doesn't show anything.
Correct. Correct.
Yeah.
And they
Yeah.
were expecting some big answer to be
Sure.
revealed.
Sure. So a lot of times MRI is not the end all be all. Okay. It's very effective. It's very, it's an advanced imaging technique. It does show a lot more than a plain film X-ray, more than, what a CT, a CT CAT scan will show. They're for different things. But when there's a negative MRI, or, you know, virtually negative, there could be ligament injury. There could be, facet joint injury. And we will send them to get that. Motion x-rays that's when that comes into play a lot, to show if there is a ligament laxity. A lot of times those injuries are worse than, something that you would find on a non-contrast MRI. And then we get them to the right specialists if it's, beyond my realm, beyond our realm. Of course, co-treating, but we get them to the right people who can take
Sure.
care of those types of injuries as well.
Sure.
Yeah, so it's not always going to be found on an MRI. We hope that will show it, but it's not always the case. So there are other avenues, and there's injuries that are not picked up on MRI.
What impact do you think our modern lifestyle has upon recovery or even making people more vulnerable to injuries? We're sitting at desk, our heads are bent over looking
Yeah,
at
yeah.
cell phones. What's your thoughts on that?
Definitely a very high contributing factor, I believe. The more sedentary that we become, the work from home culture, especially if you're not getting out and being active. I mean, we weren't designed to sit at a desk. We weren't designed to sit, really. So physical activity is key. Not necessarily CrossFit training, but
Okay.
you need to, I one of the things that I'll tell pretty much every patient that was involved in a crash, especially if they're having, new headaches, or worsening if they had, some form of a headache prior occasionally, but this is new and different, and a traumatic brain injury scenario. One of the best things to do is to get out. I tell people, if you can't get on a treadmill or can't get on a recumbent bike, go to your local high school track, and that you want to get them to figure out what their maximal heart rate is, and get their heart rate up to that, or near to their maximal heart rate as they can. Everybody's different. You don't want them to, to stress themselves into having an issue. But so get to the maximal heart rate, and if you're walking, or you're on, if you're lucky enough to have a recumbent bike or a treadmill, and you get to your maximum heart rate, and even within 1 minute, if any one of your symptoms from an injury surfaces or gets worse, you stop. And the goal is to do, you know, upwards of 30 minutes at maximal heart rate. without recreating any of those symptoms. So whether if you had a head injury, a mild traumatic brain injury, and you were having headaches or dizziness, and any of those appear within whatever period of time, you want to stop and get back to it the next day. That's one of the best things. So physical activity is key in rehabbing, especially with the brain injuries. But it's just perfusing your body with blood flow and oxygen. A lot of people, again, because of that sedentary lifestyle, and even if folks that have warehouse jobs, you know, but it's not quite the same, and they're probably not using proper ergonomically
Right,
sound and
right.
proper biomechanics. So I try to counsel them on all those aspects. But yes, the cell phone, text neck is a
Uh-huh.
term.
Okay.
All of that can be contributing factors to worsening an injury when it occurs.
Okay. What do you see? And you've mentioned a couple of these, but any other really glaring mistakes that people make right after a crash? You mentioned the heat.
Mhm.
You mentioned waiting to get checked out and see somebody. Anything else that comes to mind?
So yeah, so some people will, and it's all those chemicals I think are contributing, that cascade of inflammatory chemicals. They will, I don't want to use the word party, but, go and maybe feel like they want to have you know, like a fried chicken meal or a greasy hamburger makes you feel good,
Okay.
or a sugary drink, or something. Chocolate is, I love my dark chocolate, but it's one of the things that, so those types of things, or having a drink, alcohol. Alcohol is, for lack of a better term, it's really poisonous. And, that, so sometimes if you're stressed from one of these events, whether it's a slip and fall or an auto injury, and they don't think that they're hurt, and they'll add fuel to the fire by having some, oh my God, I just was involved in a wreck. I fell down off my ladder. I need a couple drinks.
Right,
Uh,
right.
One of the worst things you can do.
Yeah.
One of the
Okay.
worst things you can do. So, yeah, those things, dietary factors, people tend to self-medicate with bad choices in food. We're all guilty of it, obviously, but it you have to. And we're lucky we know these things. Most regular lay persons do not, and they don't think about that. You don't think about how that's going to affect their recovery or possibly, like I said, add fuel to the fire.
Okay. When people are doing those things, and I guess they're kind of, training their body to not recover like it should, how, if they're not verbally coming out, is there a way for you to sort of tell that, like they're not responding as quickly as they should, so something's up?
Oh, like if they're in active treatment and things are not getting
Progressing, yeah.
progressing.
They may not be telling you, "Oh, well,
Right. Yes.
I
Sure.
have 6 drinks a night," or
Yeah. Yeah.
whatever.
Yeah. How do you get that out of them? Yeah, that's a good question. I haven't really figured out
A
ways.
good way.
I mean, you can, conjecture, right? And after a certain amount of time, you kind of get to know somebody a little bit. You can sort of, I don't like to judge, but you can judge their lifestyle and that kind of thing. So, you know, gently, bring it up. Don't forget, I always tell people to, throughout the course of treatment, hot shower and then biofreeze, like that Epsom salt bath, the heat, the moist heat, it has to be a moist heat. That's another thing. A lot of people will use old style without like a bladder, like those heating pads, electric
Okay.
heat. Even the electric heat in the car, in your vehicles, is doing damage. It feels great, but it's drying out those tissues. It's almost like making your muscles into beef jerky, basically. I use that a lot. whereas the moist won't, but it's like you're dry. It's like you're smoking, right? Your muscles are in a smoker and it's dry.
Mm.
You're just drying out those soft tissues, whereas moist heat. And I say hot shower and biofreeze. If the first thing you
Okay.
do when you get up in the morning is hop into the shower, that's moist heat. You want to calm everything down after that. And always, I reiterate, drink more. If you think you're drinking enough water, drink more.
Drink more. Okay.
Yeah. Yeah. Because you're just going to flush out the bad, And another thing, because a lot of people will overdo it also, it's one of those catch-22s. Some people take that to the extreme and they're flushing out electrolytes. So I always recommend, there are a lot of those powdered electrolytes on the market. Some are better than others, but some is better than none. And if you don't like the taste of water, which a lot of patients don't, you can find a flavoring. It's not, it's very low sugar. Add those electrolytes into your water, and I find it helps people drink more water. And then
Okay.
they're getting those electrolytes in there as well.
What is the difference between being pain-free and actually being healed?
Yeah, so symptoms are typically, those pain is a symptom, right? It's like the check oil light in your car. So pain is typically it shows up last and it goes away first, right?
Okay.
Doesn't mean that everything is hunky-dory, is A-okay, is back to normal. So, based on, we're in a touch profession, so I can feel the joints and the objective testing. That's really my go-to. I think
Yeah.
after 30 years of doing this, I can tell when someone is at least back to the state that they were in. And like I said before, Darrell, sometimes even better.
Right.
Someone who's never had any kind of, hasn't taken care of themselves or has never had any type of care, and sometimes it's almost a blessing in disguise because they're finding, this great method of taking care of themselves. And I haven't felt this good in years, doc. I mean, what's going on here? Well, it's just your body, their body responding and removing any type of nerve interference
Mm.
that they were experiencing, even prior to an incident, even prior to an injury. So
Mhm.
that's
So it's like they're catalyst for any type of change that's going to improve
exactly.
their life.
Yep, is a good change. Yeah,
Okay.
absolutely.
After a wreck, from you, what would that be?
So again, you want to definitely get yourself evaluated and examined as soon as possible after an incident. Get proper care, get your rests, but also remain active. Don't, fall into that pattern of I'm hurting, I don't want to do anything, I don't want to move. Moving hurts, right? So movement is life. Movement, the more you move, the better you are. So get checked out right away. And that's the go-to. You don't
Okay.
want to say, I thought I would get better. And
Right.
then
Right.
3 months, 6 months, a year down the road, you step off the curb the wrong way, or you're at your desk and you reach for a pen and you twist, and all of a sudden, you're on the floor.
Right.
It didn't just happen at that time. It didn't just happen then. It was there was a cascade of events that
Mhm.
happened. And the catalyst is, usually it's, you can trace it back to one significant event, whether you thought it was significant or not. So,
Well, that's a great segue into letting everybody know how they can find you, where your clinic is located or clinic locations.
Absolutely. So I am clinic director of Southern Crescent Clinic in Fayetteville, Georgia. We are close to Fayette Piedmont Hospital, across from Yorktown Medical Center. My office is 874 Lanier Avenue West in Fayetteville. The phone number there is 770-461-1009. We also have offices in Noonan, Georgia, and in Jonesboro, Morrow, Georgia. So, yeah, if you ever need, and really, I tell people all the time, if any questions, if you've had any kind of an issue, any questions, please give me a holler, and we'll have you speak with Darrell, and he'll lead you on the right path.
Great. Sounds great. Thank you so much. It's been really, really helpful. I think so many people fall into that category of, well, it was just minor, or once the symptoms do arise, they think that they're going to just go away magically on their own. So this has been very, very incredible to hear. And thank you for being such a good resource and a valuable benefit to the community and the people that come and see you.
Thank you, Darrell, and the same goes for you. I appreciate you taking the time. This was wonderful, and like I said, if any questions, anything I can answer, I'm always available. So
thank you so much, and we'll grab lunch again soon.
Absolutely. Look forward to it.
All right.
Have a great rest of your day.
Bye-bye.
Thank you. Bye-bye.
You've been listening to Crashes, Claims, and Clarity with attorney Darrell Burrow, founder of Burrow & Associates and a trusted advocate for over 30 years. If today's episode helped bring clarity or hope after an accident, be sure to follow, subscribe, and leave a review. To connect with Darrell or learn more, visit legalatlanta.com. Join us next week for another honest, faith-centered conversation about recovery, rights, and moving forward after injury.